Hello, everybody.
Hello.
Yeah. So I can't hardly help but be excited because I'm talking about a funny topic, but I'm also talking about something that's extremely important. Tonight's topic is called PoopTastic. So the reason that's important is because you have an objective view of health hopefully every day, that most people do their paperwork and hit flush before they actually understand what's really going on. So today I'm going to give you a detective's license to make you a digestive detective for yourself so that you really understand what you're looking at. And in fact, when I'm done, I'm hoping that you'll throw paper on the side so you can actually see what you're talking about right there. Got it? Instead of just get it on the top right there, right? So, but a couple interesting facts. Did you know that you have more individual bacteria in your gut than you have cells in your body? Did you know that?
No.
Right? That's pretty important. You know you have 4 pounds. You have 4 pounds of bacteria in your gut. 4 pounds. Did you get that? 4 pounds. How about this for a fun fact? Do you know that there are 4 bags of poop on the moon? Did you know that? Left there by Neil Armstrong when he was doing his moonwalk. Some people don't know that. How about wombats? Wombats poop too, right? Guess what? It's a cube. They poop in a cube shape, and they actually use it to find where their home is. How about that? So maybe don't leave a trail so you get home, but that's just saying wombats. It's pretty crazy. Panda bears. Panda bears can poop 48 pounds of poop a day.
What?
How about that one? Because it's all roughage, right?
Wow. It's all big.
There's something to talk about right there. 48 pounds. Now, I mean, that's something to brag about. 48 pounds. How about this? Early 20th century horses, because they were pooping, they were doing so much pollution that automobiles were considered the green alternative. How about that one? Green alternative. Well, we came up wrong on that one. But sloths, how about sloths? Sloths only poop once a week, and because it's such an event for a sloth, they actually have like a sloth dance that they do. If you actually look it up on YouTube, you'll see a sloth poop dance. It really is a poop dance. And they poop, and they do it through this little poop dance, and then they poop. I'm serious. It's a week thing. So just a lot of fun facts. Now, let me say this. We're going to go through a lot of cool stuff tonight, but I want to give you resources. So we're going to have some fun. Raise your hand if it's okay to have some fun. Ready to have some fun? Let's talk about poop. Let's have some fun. I want you to leave here with a lot of great information, and I want you to understand 2 things. Number 1, I want you to have some daily specifics, like brushing your teeth for your digestive system. Got it? So just daily action steps that just will lead to health and digestive health and all the rest. I also want you to be able to identify if there's a problem, and if there's a problem currently, I want you to leave with a solution. Everybody with me? Okay, I want you to leave with a solution. Okay. Here's a lineup. I love that picture, right? But we've had so many things recently that maybe we want to do this talk again. I haven't done this talk in about half a decade. But the reason it's important to me is because when we sit down with a lot of very, very ill people. And before they had their diagnosis, you could go back 5, 8, 10 years, and you'd see evidence digestively that something was wrong, something was up. But that person did not understand what they were looking at, so they didn't say anything. Their medical doctor sure didn't ask. And as a result, guess what? Something went miss, and it went miss long enough that now there's a diagnosis. And so for me, it was so important for you guys to be here. Even though I know it's funny, we're talking about poop and stuff, but it's important for me because I don't want to come up short one day and you come in and tell me, hey, something's going on. Got it? Okay, does it make sense? Because I love you too much. So, but I will say this, we've just seen some amazing miracles. We had a guy just recently who was supposed to have his entire colon removed. And between the things that we get, the same things I gave you to do tonight, and you'll see this as far as repairing your gut lining, thickening it back up, closing the gap junctions, leaky gut, IBS, Crohn's, all these things. The same things we gave him, they literally went back to do the surgery. They went and took a look at it and go, well, it's all healed up. We're not going to take it out. So he saved his colon completely. And so that's the kind of results I want for everybody. Let's move into this. Yes, potty humor. I love that. Captain's log. Okay, there was not laughing in the room. You guys are so uptight, right? I mean, we're up to our knees in this thing already, and you guys, I've been studying so much on this topic, I'm full of it. And not one person is laughing at this. It's crazy. All right, let's just go to the State of the Union. There's 3.7 million ulcers a year. Digestive disorders cost there's 70 million digestive disorders diagnosed a year. 141 B, that's a billion with a B, billion spent on just digestive issues alone in the United States. And there's 13 million people hospitalized for just one thing, digestive problems. 13 million. Everybody say 13 million. 13 million. This is a big problem, not a small problem. And when you start talking about the digestive system, you realize it affects what? Everything. It is your powerhouse. Does your engine, which is only one part of your car, does it affect how your car works? It is exactly how your car keeps going. In fact, if the engine's not good, then go ahead and get rid of it, get a different one. But you can't do that with the digestive system. Now, what causes the stress? And we're going to go through some of these tonight at more length. But what causes it? You see this at the bottom. This is a big one. And I have people go, well, I had to take it. No, you didn't have to take it, right? Unless you're about to die and there's some kind of flesh-eating something on you, the answer is no. And because right now your ecosystem is so incredibly diverse and complicated in your digestive tract, just watch this. Do you know if you take a non-steroidal anti-inflammatory, I'm talking about Advil, ibuprofen, Tylenol, things like this, do you know it inhibits, like right now if you had a petri dish and you try to grow good bacteria on it, if you put a non-steroidal anti-inflammatory in it, it will actually keep the good ones from growing and it will cause the bad ones to grow. Did you know that? It's like fertilizer for bad bacteria, and it inhibits good bacterial growth. So that's why if you take a Tylenol, even one a month, you will cause dysbiosis to some degree, whether you feel different, whether you have diarrhea, whether you don't have diarrhea, which affects everything from joint health to everything else, and we'll get into that tonight. Pain medications. Why would pain medication? Who here has had a surgery, or you had something recently, or even last 10 years, and you took pain medication? And so, listen, I had molar surgery, and they cut me all open. I had to take this stuff for a couple days, but my colon was backed up. I got constipated. Anybody got constipated before from pain medication? The reason, because pain medication affects smooth muscle. And your digestive tract is a smooth muscle, so it doesn't contract as well. So you end up causing some impaction and constipation. So pain meds affect it. Antibiotic exposure. We go out and take an antibiotic. Well, if you're eating conventionally raised meat, get this, and if you're taking notes, lots of good quotes today. Guys that are watching on the net, make sure you hit pause and write these things down. But 80 to 85% of all the antibiotics on the face of planet Earth that are produced today are consumed by the livestock in the United States. Did you hear what I'm saying? I'm talking about all the antibiotics on the planet. 85% of them are consumed by livestock in the United States. Number one, because when you consume livestock, you get heavy. You actually start gaining weight. Why? Because you ruin your bacteria count and your metabolism shuts down. So just so you know, if you want to lose weight, make sure your guts are good, okay? But antibiotic use, exposure through conventional products. Alcohol intake, because alcohol turns to what? Sugar. And then sugar intake, or anything that turns to sugar. Eating on the go, why would that mess your digestive tract up?
No idea what you're eating.
You have no idea what you're eating, number one, possibly. And the quality of food when you're on the go is probably a little bit less, yes or no, right? Number two, when you're on the go, do you chew as well? No, so you're swallowing larger pieces. Who here has ever put too many pairs of jeans in the washer at one time? Or, right? Did it ever come out as clean? It's not as clean, is it? So if you're eating bigger pieces of food instead of chewing like you should, it's the same thing. It doesn't digest as well. Does that make sense? It's a good analogy. Last thing is, on the go, you're usually what? On the go, right? You're not relaxed, you're in a hurry. And if you're in a hurry, guess what happens to your digestive tract? It doesn't want to rest and relax and digest well and whatever else. Also, if you're extremely stressed out all the time, I only have 17 minutes for lunch, right? And you drove 90 miles an hour to get home for the 7 minutes that you can stay there, or whatever, right? On-the-go lunches can do that too. Bacterial overgrowth will cause we'll talk about what causes it. Consumption of processed foods. Processed foods, the reason that processed foods are so bad for your digestive tract is it's the difference between almost like whole grain bread. It's heavy, there's a lot of fiber and stuff in it, and like a sardine, what is it, saltine cracker? I don't even know what it is anymore. Saltine cracker. You put that in your mouth and it turns to like a glue, right? The reason it turns to glue is processed foods and things like that. They're so processed that they basically turn into their lowest denominator once it starts going through digestion into like glue and like sludge. And it literally impacts through the microvilli. Watch this. If I spilled some broccoli, some raw broccoli right now, I could pick it all up, yes?
Yes.
If I spilled this pudding on the floor into the carpet. Would it be easy to get out of the carpet? No. Not as easy, right? And the reason, because it does what? It soaks into the carpet. Well, the carpet right now represents your microvilli, and we'll go through what that looks like here in just a minute. But actually, that's just why. Does it make sense? Everybody with me? Now, what does this affect? What's it cause? And just look for your symptom there. I have so many of you guys that have issues with this, but you don't realize that it's actually causing the very thing that you want help with. And you're like, you adjust my neck, but I still have that problem. You know, my back, you adjust my neck, but you adjust my back, but I still have that problem, right? Why isn't this gone yet? And I want to say it is almost impossible unless you have all 5 essentials that you're dealing with. Because oftentimes this can cause the pain that's still there. This can cause the metabolic disorder that's still there. This can cause the depression. Listen, how in the world, look at the bottom, how in the world can your digestive system cause depression? Well, low blood sugar. Yeah, that's true. But guess what? When they give you an antidepressant, what's the name of the neurotransmitter that it works with? It's an SSRI, and S stands for what? Serotonin. Well, guess where 85% of all your serotonin is created? In your gut. 85% of all your serotonin is created in your gut. So if you have digestive issues, it is completely linked to depression, anxiety, ADHD, hyperactivity in children. Does it make sense? This has to be fixed. And so I'm going to give you guys some great things. But this, I mean, from bad breath to heartburn, allergies, joint pain, skin issues. And listen, I still have problems with skin issues and things. And you'll see sometimes I'll come in, it's either because I'm detoxing or maybe I cheated on my diet a little bit. But the reason for me is because my parents were trying to help me out with acne. Because I was eating cinnamon rolls every morning, and I was eating cow's milk with bovine growth hormone and frosted flakes and whatever else. And as a result, guess what? I had candidiasis, I had all these things, and I had horrible acne and cystic acne. It was different. And so my parents hated to see me go through that, and so they took me to the doctor, and the doctor gave me an antibiotic. Well, on an antibiotic, it killed everything, so my face would clear up. And the day I would get off of it, my face would break out again. So guess what the doctor would do? Put me on another one. I stayed on it for more than half a decade, almost every day. What do you think that did to my gut? Oh yeah, it turned into Swiss cheese. It was horrible. I'm still getting over that. So that's kind of my deal. But how about this? Digestive energy use. The reason this is also important is raise your hand if you like to have more energy. Just raise it up. Watch this. To digest 3 meals a day, not even big meals, just 3 meals a day is equivalent to you running with an amount of energy it would take. If we got up right now from these chairs and we went out the front door and I got a pedometer and we had to run 10 miles and not jog it but run the whole time fast. That's how much energy your body uses to digest 3 meals a day. And here's the problem. Right now, some of you guys could go do that. But if something started to break down, like your knee or ankle wasn't as good, right? You could still probably push through the miles, and you probably have to walk a little bit or whatever else, but you still get through it, right? Mm-hmm. But eventually, some of you guys would just stop. You were not going to run the 10 miles anymore. But guess what? You can't do that. You have to eat. And what happens is, if there's even something a little bit wrong with any part of your digestive system, guess what happens to your energy expenditure to get the same amount out of it? It goes up. So all of a sudden, it's like running 20 miles instead of 10. And so guess how you feel at 10 and 2? Or you get done with work. Who here has finished work in the evening time and just almost didn't have anything left? You just went home and you're like, I know I need to eat dinner. Right? And why? It's because your body's shot. Sometimes it's, you go, well, I need an adjustment. Well, sometimes you do need an adjustment. Sometimes you need an adjustment to this. And that's what tonight is. You ready for that? Got it. But this is the system. This is a magical system. God put this thing together. It's amazing. And I want you to look at it differently. If I eat an apple right now, watch this, metaphorically. I take a bite. And I start chewing it. Is it in me yet? It's not in me yet. Let me swallow it. Is it in me now?
Yes.
Is it?
Almost.
No. It's going there, getting there. Watch this. Your body views your digestive tract as an open hole here, a hole there, and a tube that just runs in between. And anything that's in there is outside of you. Did you get that? It's not in you until it is absorbed through that wall. Okay? That's why 85% of your immune system is in your gut. Everybody with me? The reason I want you to look at it like that is because you got all these 24 different organs of digestion that are working along this tube all the time, right? So I eat it, right? Does the same thing that happens at the top Do you think it should happen at the bottom? No. Every different place has a different function to do exactly what it's supposed to do. And do you think it's different per food that you eat? Yeah. Do you think the pH in your stomach should be the same for an apple as a steak? No. In fact, actually, guess what makes the decision on what exactly should happen at exactly the right time every single time? What system? Nervous system. It knows exactly what the pH should be in your stomach at every... What if you eat a steak and an egg one time, and now you eat steak and a broccoli and asparagus and a potato? Should the pH be the same? What if you ate the broccoli first and the steak second versus the steak first and the broccoli second? Should the pH be different? Yes, it should be. And how in the world do you know how to do that? Well, you don't, but guess what does? This. And the reason that the first thing that you need to understand about making sure that you have a nerve or a healthy digestive system is that you have to have a nerve system healthy first. Does everybody hear me? Right? Raise your, do you have any guests? Raise your hand if you're a guest. Guest? So got a guest, got a guest, got a guest. You're always a guest, even though you've been here before. But the point is, this is the first start, okay? So I can give you everything under the sun, but especially the guests, if I haven't sat down with you a lot, if you have a digestive situation, please don't spend money and try a bunch of these other things. I'm going to give you some cool tricks tonight. But could you see how if there's a problem with this and your brain cannot tell things how to run effectively, you could spend a lot of money and come up short. Right? Who knows somebody that did that already, probably, right? A lot of people, right? So the first thing you gotta understand is you got to check the spinal column that is the body armor for this first, right? And most of you guys are here as patients so that we're already doing that, okay? But let me give you an example. What's wrong with this low back? Okay, first of all, it's looking at his back like this. Okay, there's the hips at the very bottom, ribs in the middle, and then middle of the back is up. It should be straight up and down. Do you see it? So we call it a scoliosis, although it's not 18 degrees just yet, but it's crooked. Yes? Can you see that?
Yes.
Would that put pressure on the nerve supply, yes or no?
Yes.
All right, so he comes in, he's got IBS diagnosis, but he's got a ulcerative colitis is what he has. Twice a year it flares up. Raise your hand if you know anybody with ulcerative colitis. Anybody? Yeah, know somebody? So ulcerative colitis is where your colon has ulcers, basically holes that it makes it look like Swiss cheese, red holes in it, okay? Probably not good, would you agree? Horrible. You actually flush everything. Like you can't hold anything in. You have massive diarrhea. You start having, it can be life-threatening. Anyway, so the only really solution medically is to give you an anti-inflammatory through steroids. So steroid shot, oral steroids. So you just blow people up with steroids so it decreases their inflammation. Got it? So twice a year he has a blow up, has to do massive amounts of steroids. He's gained weight. He's got issues. It's actually eating the cartilage from his knees and his nose because that's what steroids do. Comes in here and listen, he was like some of your spouses or people that you brought in who just don't believe this at all. Complete skeptic, and actually started care because he's going to prove me wrong. I kind of like those, right? We go until we get in here. This is about the first of his his year. But 2 months into care, his ulcerative colitis is gone. Now, does an adjustment treat ulcerative colitis? It's hard to ask that question because it was gone through his adjustments. The answer is no. The adjustment doesn't treat anything. But what it does do is it improves the nerve supply, so your body, which can heal it, does exactly that. Does that make sense? So now he goes a year and he doesn't have any issue with his colon. Goes a second year. Never has an issue with his colon. He's lost like 20 pounds. Goes to the third year, doesn't have any problem with his colon. Gets it through his third year. He's like, you know what? I love this, but I drive about 45 minutes to an hour to get here. I love it. I had a job change. It's a lot of money. It's a lot of time. I believe you. I love you. I don't want to stop care, but it's expensive and whatever else. So he stops, right? And the reason is because he's felt good for how long?
3 years.
For a long time. And now he's thinking, I kind of got this now, right? I haven't had a problem in a long time, so I think I could probably go without it. But if he doesn't keep up with this, it's going to what? Yeah, it's just gravity, right? So he goes 2 years, and I get a call, and he said, because raise your hand if you have my cell number. Everybody has it. So I get a call on my cell phone, and Tim, he said, hey, listen, I need to come back in. My colon's done that thing, and they want to put me on steroids. I said, well, come back in. And I said, but I'm going to get an x-ray of you. He goes, I don't need an x-ray. And I'm like, yes, you do. So I take an x-ray of him. Now watch. What's back? But watch, it's not that the back was bad, it's that the back causing the nerve supply was bad. He didn't have back pain. What did he have? His colon. Does he get that? You have to have a nerve supply first. Is everybody clear on that? Okay? Perfect. Guests here. If you have any symptom that's on this list and these are the most common ones, doesn't have to be on there, you have lost 40% function in a tissue or organ already, tissue, cell, or organ, which means that there needs to be something done when? Now. Moving on to this. Let's talk about our PEEPs. Now I'm going to go through each one of these. You guys ready? So here we go. This is the stinker sinker right here. He's your evil suspect there. Notice how black he is. You see that? He is very, very tar-ish. And the reason for that is lots of processed food or a toxic buildup of some kind. Occasionally you see smokers will have this as well. Oftentimes you're taking pharmaceuticals, they'll do this. Okay? Generally a stinker sinker is exactly that. It sinks. It'll leave struggle marks after the flush. See, we're talking about poop. Isn't it awesome? Right in front of God and everybody. It's awesome. Struggle marks. I know. I love it. Anyway, the stinker sinker will be like greasy. It'll be toxic. It'll be just like a greasy, dark thing, right? So just imagine a toxic buildup. That's what a stinker sinker. Also, it sinks, doesn't float. Okay. The next one. He's the swimmer, the skinny guy right there, okay? The swimmer, notice his color. He's a pale, kind of a tannish, whitish. Anybody had a white poop ever? I have, right? It's a comfortable room. Come on. Am I the only one? So like a tannish poop. The reason for that is, watch this, the reason is because it's got a high fat content. So if you have, I'm going through this is what you need to know, because when you see these things, I want you to understand it. If you have a swimmer, it means that it swims. He's on the surface. The reason it does is because a high fat content poop will float, because it's fat, right? So high fat content, it'll float. It also means that you're not possibly digesting fats the way that you should, okay? If it's tannish or lighter color, it also means that because you're not digesting it, there may be an issue with your gallbladder, or if you even have one. Oftentimes if you don't have a gallbladder, it'll look like this. You may have some stones, you may have a liver issue, things like this, and so you want to look for that. Make sense? Now listen, can you have this occasionally and it be okay? Yeah, it's okay. Different things can cause it. But if you start seeing this regularly, I'm seeing patterns and stuff. Got it? So that's the swimmer. Next one, okay? Mr. Jacked, okay, like the bodybuilder. The reason you see this is he's squatty. He's a squatty potty. He's a big, thick, round. He's the one, if you ever popped a blood vessel in your eye trying to poop, you've met this guy before. He won't come out, right? Busted a hemorrhoid or something, now you got blood in the toilet. This is your guy right there, okay? This is the guy that makes you go, oh, I gotta breathe. Are you with me? Come on. You knew it was going to be animated with me tonight, right? The reason is this guy is high protein. So if you had like too many protein bars, or you went to Heart 8 barbecue and you didn't have any vegetables, like lots of protein, right? And I can easily do this personally because I'm like a T-Rex. I love protein. But this is it. So high protein. Now, high protein, do you think it floats or sinks? It sinks. Yeah, so I mean, you won't hear a tink when it hits, but it actually sometimes you'll have a wet bottom because it'll go oop and then splash you. Right? Isn't this awesome? Yes. These are jokes, folks. These are jokes. All right. Now, the next guy. Rabbit poop. Right? Rabbit poop. This guy right here. Looks like little curds put together. Now, most of the time, they will be together still, but they look like little balls put together, like you had melted M&Ms and you put them all together. Right? Sometimes they won't be. The reason for that also is a change in peristalsis. Peristalsis is the name of the muscle movement that squeezes like this and squishes the bolus through your digestive tract. Okay? Changes in peristalsis can happen from dehydration. So dehydration can cause this. Sometimes you can get a dehydrated bowel by drinking too much coffee. Some of you guys will not poop in the morning until you have coffee. That's not a good thing either, just so you know. But dehydrated bowels will cause this. Also, highly amounts of processed foods will cause this. Because what happens is you have hostra. Does anybody know what a hostra is? It's a little bows, like you have little bowls almost throughout your whole digestive tract, and then the muscle contracts and then pushes it out. If oftentimes peristalsis slows down or it stops completely for different reasons, it'll sit in that hostra and it'll just make a little round ball, and then put them all together and then it'll come out, it looks like rabbit poop. Got it? So dehydration, constipation can cause this. What's the next guy?
Diarrhea.
Diarrhea. when you're sliding in the first and you feel a little burst, diarrhea. Everybody knows it. You've sung the song. Don't pretend you haven't. Look at you. Look down your nose at me. Now, what causes diarrhea? Very, very easily, diarrhea is caused by a lot of things. Sometimes, who here has been so stressed out ever that you had diarrhea? I have. The first year in practice, it was really, Kimberly and I really struggled. And by the way, I'm going to take a minute here. Today is my 18th wedding anniversary. Today, yeah. It's awesome. Yes. I talked her into marrying me for 18 years. Yes! I have done well. Listen, I married up. The fact that I got that to marry me is good right there. But listen, so it was a struggle for us. And I remember being that first year, we struggled. We didn't have a system to teach people, and I just had a heart. I just wanted everybody to get this. And people really die without this. And I somehow got to get this out. And I had all this heart. I couldn't get it to people. And we literally, there was times where I didn't know if we were going to pay our bills and have to shut the front door. And if I had this whole team of staff, this one person, and I had to pay her. And I literally, for a whole year, we would get on our stomachs at the end of the day. We still do it occasionally, but on our stomachs and just thank Jesus that we could pay our bills. And I can tell you, sometimes I would look at the bank account and be so worried I would have diarrhea right when I looked at the bank account. Seriously. And I lived like that for a year. But I can tell you, so diarrhea can be stress related. Oftentimes, if there's not a huge amount of stress or emotional, sometimes if someone dies, you can have diarrhea too. But if it's not an emotional thing, it can be caused by processed foods, simply by, watch this, the food additives in it, or just how highly processed and irritating it is to the lining. Okay? So if it irritates the lining of your digestive tract, then it's almost like your digestive tract says, hey, I can't keep this in here very long, and so it doesn't get a chance to absorb the nutrients, but also the hydration from it, and then create something that's more solid, and it just gets rid of it. And so you have diarrhea. Does that make sense? That's where you get diarrhea. Next one, the flasher, right? The flasher. The flasher is being able to see what you ate, right? So now, corn is one thing. Corn, unless you're chewing it great, you're going to see it again because the husk is very undigestible, right? So a lot of times you'll see corn there again. But stuff like carrots or broccoli or spinach or things like this, like if you see your food in there, whether it's diarrhea or not, it's usually caused by what's called a flashing, or that's what we call a flasher, a flash. If you're flashing your colon often means that you have an inflamed colon. That I don't like to hear very often. But if it happens very often, I want to know about it. Okay, and it means that we need to do something tonight for sure with your action steps. Make sense? You don't want to be seeing a lot of food that's recognizable. Does it make sense? Yes. Okay? You don't want to be having a flashing colon. Okay? The guy on the far right, that's what everybody wants to look like with your colon. And actually, not to be embarrassing, but I had one today. I was going to take a picture. I was like, that's probably not good. You can't be taking a picture. But you want something that looks like that. Oftentimes I'll get Dr. Kimberly go, look at this. I'm not going to flush that. That's just so good. That's love right there when you look at it. So, and she's still married to me in 18 years. Come on, everybody. Awesome. All joking aside. Okay, so let's go. This is the Bristol stool chart. Again, you can look this up. Bristol stool chart. Just a really good, simple thing. It's online. If you Google it, Bristol stool chart, and it comes up on images. It's the first thing that comes up on images. There's 7 different stool types, and it's basically what we went through. But the first 2 are constipation. 3 and 4 are generally considered normal, and then the last 3 are basically diarrhea. And it'll give you just some easy things that cause. Make sense? Yeah. But I want you guys to know that. So if you didn't take really good notes, Bristol stool chart is very important. Okay? And it's widely accepted. I don't want you to have to go to your doctor. I'm the stop. You don't need to go to your medical doctor. He's only got 1 or 2 things, drugs or surgery. It's not going to fix your colon. So make sure you come here. But if someone asks you about your colon, that's a good place to start. A Bristol stool chart type 4, type 7, or whatever else. Next, let's talk about regularity. Okay? Everybody say it with me. 3 trains in, 3 trains out. If you're eating 3 times, guess how often you should poop? 3. Now, some of you guys will go, well, I go at least once a day. And my doctor said that's just fine. Well, listen, it may be just fine, okay? The problem with it is you have a gastric colic reflex. And some of you guys have beat that to death where either subluxated so bad it doesn't work anymore, or you've reflexively told it to not do that anymore because you're holding it or whatever else. And so when you eat and you put something in your stomach, it tells your digestive tract, your colon, to say, hey, get rid of that, I got something coming, right? If I ran a train station, I had 3 trains coming in every hour, but I only had 1 train leaving every hour, eventually by the end of the day, what's going to happen? I am stacked up. Guess what happens to your digestive tract? It gets stacked up. And here's the thing. What you don't realize is the little bit of weight, and some of you guys actually have if you're measuring, like that girth here, I don't have like a weight. I can't pinch it, but I'm bigger now, or my hips are bigger, whatever else. It's because you stack into that digestive tract constantly, and you are impacted through different areas. Does it make sense? Right? Very, very simple. It's not hard. But 3 trains in, 3 trains out. You want to have them. Okay, that's regularity. Color. I love it. Isn't this awesome? Regularity, color, texture, the stinker sinker. So color, let's go through this. What makes your poop brown? How about that for $1 million question? It's bilirubin. You want brown poop. Sometimes it's a little browner, sometimes it's not as brown. But when you're using up red blood cells, how many red blood cells did you make brand new today? Do you know? Do you know the number? I said it about 3 weeks ago. 1 billion. You made 1 billion new red blood cells today, and you're not even tired. How about that one? So you got rid of 1 billion, and guess what happens? They go out your stool, and the used up bilirubin is brown. Make sense? That's why your poop's brown. Are you learning something? Is this cool? It's awesome. So brown, should be brown. If it's yellow, it's kind of like the swimmer, right? Tannish, kind of yellow. That means there's too much fat in it. Most of you guys won't have a yellow stool. Sometimes you will. But usually it's because it's too much fat. Now, number 1, it's malabsorption. Number 2, what it says right there, is it's an irritated mucosal barrier. Oftentimes you'll have that. Sometimes you can even have mucus on the actual stool itself, and that is something that we want to talk about. We want to make sure that we're going to do a GI reboot program. I'm going to tell you about that here in a minute. That's how you want to really settle that thing down again. You do not want to have massive amounts of mucus in this thing, and if you are, we need to talk about your diet, number 1. Number 2, we need to talk about the health of the lining. We need to make a change today. Next, green. Green poop. Anybody had a green poop before? Right? Not just because you had spinach or something. And it's usually an indication that there is bile in it. The bile didn't have a chance to digest or get reabsorbed, and so you're actually pooping bile. Anybody here threw up so much that the only thing that came out was some green? Right? You had food poisoning or something? Well, the other end of that on this side, green, is actually bile as well. That means that the transit time from here to here is not long enough, and things are going wrong. So you don't want to have a green poop either, okay?
It's not spinach.
It's not spinach.
So it could be like after you got a stomach virus or something?
After you had a stomach virus, those things, generally the transit time's not enough to reabsorb. Generally it's an irritated lining because it should stay in the colon longer even if you've got something going on. But if it's not, if it just goes right through, it won't have time to actually, what happens, your body is so amazing that it reuses bile. It's also why if you're detoxing, that we have that detox product called Detox System. The reason that we do that is because at the end of the day you take the activated charcoal, because if you don't, your bile, which is a lot of stuff from your liver, that's how you detox, comes out in your bile, and then your body actually reabsorbs it, and about 85 to 90% of your bile is used again. It goes back through again to the liver, and you have all these complex chemicals and stuff that you guys are trying to detox naturally from all the time, but your body gets the bile back to the liver again, and guess what? You brought the chemicals right back with it. And so what we end up doing is, as you go through this detox system, you take one to get stuff out of the cell, and at nighttime you take the activated charcoal and it grabs all of the chemicals and it pulls them all the way out through the stool. Got it? Also, write this down. Everybody, it's very important. Everybody write this down. I had somebody today that it was some of the people we were talking about. So we had a person today who came in who had food poisoning over the weekend, had a bad salad. Had diarrhea, throw up, whatever else, horrible, horrible stuff. Well, guess what? It went on for a long time, and it didn't have to, and there's something that you need at home, every single person, and it's called Bind, B-I-N-D, as in David, Bind, and it's activated charcoal and it lasts forever. You need to have it at home, and the reason for that is if your kids or you or your spouse, if you ever have something, or if you're on a trip, don't ever travel without it. Mm-hmm. If you ever get food poisoning, you want to start taking 2 to 4 of those every 10 minutes until the vomiting and the diarrhea stops. And the reason that will work is, if you have vomiting and diarrhea, what is your body actually trying to do? Get out, get it out, get it up, get it out, right? Well, if you take Bind, it will completely bind it, even though it's in the system, and your body will go, it's gone. And then it will naturally come out, and it won't affect you. I used to work in an emergency room, and if someone overdosed on drugs, they took like they were going to try and kill themselves, and took a bottle of pills, right? Guess what we did before we pumped their stomach? We forced a massive amount of charcoal down into their stomach, and it binds all of the stuff that's in your digestive tract so it can't absorb. Does it make sense? And then guess what? Then you pump their stomach. But for you guys, if you ever have that or your kids have it, make sure you have bind at home. Does it make sense? That's important. Okay, so you can stop those things literally within minutes. Okay? White or clay colored. It's a lack of bile. Okay, now you've got too much fat in the stool again. Sometimes anti-diarrhea medications will do it, causing that discoloration. Black. Now this is important. Now oftentimes you can have something come up to where you are replacing a lot of red blood cells at one time, and you can have a darker stool. When I talk about black, I'm talking about my pants and my shirt black. Does it make sense? Or it looks like you have coffee grounds in your poop. Okay? Now, what that means, if there's coffee grounds looking like it in there, if you haven't just been sucking down coffee grounds, that's what blood in your digestive tract, when it's digested, looks like. Okay? If you've got coffee grounds or very black stool, I need to know about it. I need a call. I don't want you to wait till Monday or whatever else at the end of the week to your appointment. Got it? Black stool. Everybody got it? That's an important one. Okay? Black stool. Red. Now, more people freak out about red than black, and that's usually not, red's usually not nothing to worry about. I can't say it all the time, but red is usually like a internal or external hemorrhoid. Oftentimes, if you have a glass of wine, if you don't drink that much, or if you drink a lot, actually it happens too, it'll cause some swelling of the vessels in the colon or around the colon, and then you'll actually, through wiping or whatever else, and you'll actually break one. Or if you strain real hard, sometimes if you got the jacked guy, remember too much protein, you'll bust a blood vessel. And you ever had that? It's like you poop, and then there's like blood, like frank red blood in the stool. You're like, oh my gosh, right? Well, guess what? It heals up too. Okay, usually it's nothing to worry about. If it continues on and on, maybe there's something that needs to be looked at. Okay, so make sure you bring it to me if there's something going on like that. Got it? But red can be a lot of things that cause it. Everybody with me? Got it? Moving on. That's color. Let's talk about health of your digestive tract from all the way from stomach all the way to your colon. Okay, now this is a simplified area. So duodenum, which is right after the stomach, all the way to jejunum, and then into ileum would be the small intestine, and then down to colon. Colon is large intestine. Everybody got that? That's kind of your anatomy study. There is a proportional amount of bacteria, more and more, the further you go down past the stomach. Make sense? Really, in the duodenum, you should not have bacteria. There'll be some in there, but it's almost to a zero count. So if you look to the right here, see it says 10 to the 0, right? There'll be some in there, but there's not a lot. As you get down closer into the jejunum ileum area, there'll be 10 to the 4, 10 to the 8, 10 to the 11. That's a lot of bacteria. Everybody with me? Right? This is what normal should look like. And it should be it is a very, look at me, very complex ecosystem. A very complex ecosystem. And the ecosystem changes per season. It changes what you're going through. It changes in your stress level. And it's there, if it's in the right ecosystem, it changes to benefit you. Do you know it changes to your benefit, that your body changes it if you fought something off? And you don't even know it, that it's actually in your favor. Do you know if you're breastfeeding, it's different than if it's not? If you change jobs and you're under stress, it changes to help you. Like, that's how amazingly complex your digestive bacterial environment is. And it's so funny, I have people that take an antibiotic as if it's like, well, I do the best I can, I had to take it, and it literally, it's like dropping an atomic bomb on your lawn. And don't think that thing's going to be working for your betterment. Guess what? They did a dental study to test the health of people who weren't sick, who took an antibiotic. They took the antibiotic and they tested their blood results to test how good their immune system was and how long it took their immune system to get back up to normal after they took the antibiotic. Right? Anybody gone to the dentist before and they said, here, take this antibiotic just preventatively? Right? All the time? So watch this. The average person took 18 months to get back to healthy. 18 months. Did you get that? It takes a long time to regrow that yard. Make sense? I don't care how much yogurt you're eating. Got it? So this is what it should look like. Now what ends up happening is, everybody look, is you start having a small intestinal bacterial overgrowth. Everybody say overgrowth. Overgrowth. What causes it? Everything we said so far. subluxation, stress, processed food, toxicity, non-steroidal anti-inflammatories. Here's something else, acid reducers for your stomach. Really common, taking a Tums or a Prilosec or something like this destroys the bacterial counts and ecosystem in your stomach. It destroys it. So what ends up happening is you have this. Everybody look. What ends up happening is you have overgrowth. You've got way too many bacteria growing way too far up into your stomach. And so what ends up happening is you start the fermentation process way too early. And this is where sometimes you'll eat and you get gassy instantly. Anybody? Come on, anybody? Right? You get gassy instantly. Oftentimes you're gassy every time that you eat. Sometimes you're bloated. Sometimes during that time of month, ladies, if you're menstruating, it's just boom, you're just so bloated. This is small intestinal bacteria overgrowth. What's the overgrowth from? It could be from a lot of things. It could be Colostrum difficile, so C. diff. It could be Candida. Every single person here, if you just live in America, you have got an overgrowth of Candida, I guarantee it. And people do the Candida diets and those things, but listen, it takes getting healthy. You can't just eat the Candida diet. You got to change the environment. Does it make sense? I'm going to give you what to do with this. But here, there's some certain things that you can do. The problem is most people don't know. Most people guess. Got it? And I don't want you to guess. If you have any issues with your digestive tract, I want to make sure that you're not guessing. And that's, raise your hand if you've done metabolics in the office, if you raise your hand. So it's like half the room's done metabolics. Metabolics is a way that you don't guess. And listen, I know that there's a cost to it. And I know you pay this cost to do your metabolics, like three something? $3.99. By the way, I did metabolics. It was $1,200 for one test for me to do it, and I charge you $3.99. I think you're getting a better deal, okay? And the only reason we did it is because we have 500 offices and we got to deal with the lab. But watch this. If you've got digestive issues or skin issues or things that are sticking around, the problem with it is, like for me, you're guessing. Like I had an energy production issue. I didn't realize I had it because I feel pretty good most of the time, but I started going down. And I'm always a crackerjack. I'm like, yes, let's do it. Like people blame, like they think I drink coffee all the time or something, and I'm not. I know it surprises you. But watch this. I was starting to crash. My thing was I was taking different stuff, but I didn't know what. And so I did this metabolics test, and CoQ10, right? Does anybody know what CoQ10 is? CoQ10? CoQ10 helps with energy production. We have most products are like 60 to 80 milligrams, and you take 1 or 2 a day. Guess how much CoQ10 I needed? 1,800 milligrams a day. And the reason we knew that is because we took the test and it showed me exactly what the problem was and exactly how much I needed, and I started taking it and I got my zip back. And some of you guys, listen, I want to sell you a bunch of stuff and all this stuff and I want you to get great results, but some of you guys have had issues so long that you need to not guess. Got it? And so some of you guys need to invest. And here's the thing. I know it's $3.99. You're like, well, it's a lot of money. But guess what? If you spent the next 3 years or 5 years or 10 years buying supplements and it's not helping, then guess what? You spent a whole lot more than that. Got it? And just so you know, metabolics, this is actually what will come back. That's what Dr. Kimberly will go through in a one-on-one with you. There's 54 different biomarkers. This entire bottom sheet right here will go through, if there's this, then there's that. If there's this, then there's that. And it goes through all of these different things so you don't have to guess. Make sense? And then we have an exact thing that needs to be done, and we fill the gap. And some of you guys, listen, we have not seen one skin issue yet, have we? One skin issue. Yeah, I have some of you guys that I can't wait for your family to sit down and go through this. That's why we're waiting for the 5 Essentials equipping class for you guys, and then we're going to be right with Dr. Kimberly. Not one skin issue yet. We had a family, husband and wife, who literally bleeding, pus, scabs all over his whole body. And how many years was he like that?
Well, from the time he was a teenager, he's about 65.
Yeah, so 50 years of this. He's seen every dermatologist in the world. They've done corticosteroids, they've done topicals, they've done IV, they've done everything with this guy. And he goes through, does this, and was he a little bit skeptical? He goes, I can't. And he was taking like 23 different, it was so bad, he had to take a lot of supplements. And now, what is this? He didn't have one lesion, I don't think, on his whole skin, right? Or something like that. Completely. Yeah, so completely gone. And so this is why we get so excited here with this. So again, but it's a gut, there's sometimes a gut issue that you don't know about. Got it? Make sense? All right, moving on. Okay. Everybody say gap.
Gap.
Really? Everybody say gap.
Gap.
Gap. Say junction. Junction. Now, everybody go like this. Put your paper down. Take your hand, go like this. Okay? Now make a fist. Now put your fists together like this. Now if you had a row of fists, if everybody put your fists together with your neighbor, don't have to do that, but if you did that, each fist would be a cell in your digestive tract. Got it? And the space in between your knuckles, you want to keep your hands really tight. Okay? The reason for that is as you eat and things digest, they will digest and absorb in between your fists. Got it? Now bring your fists apart just a little bit. Okay? Now if your hands are apart a little bit, you could have something go through there that you don't want to go through there. Could you see that?
Yes.
This is the gap junction. And what happens is, through inflammation and a lot of these things that we talk about, you have openings in your gap junctions, or you have leaky gap junctions, which means you have a diagnosis, or you could eventually have a diagnosis of leaky what?
Gut.
Leaky gut. And everybody, it's so marketed now, everybody talks about leaky gut. But they treat that with steroids or antibiotics, but the whole time it's because you've got this junction that's too wide. Does it make sense? So the solution is not chemicals or drugs, it's to get the cells healthier so that they are tight again. Does that make sense? You close it. The reason this is important to me to show you this, okay, is because every single autoimmune condition that the human body can actually have, and I'm talking everything from sojourns to rheumatoid arthritis, MS, to whatever, I'm talking about every alopecia universalis, they all start, guess where? In your gut, because what happens is you will digest food, and then they will go through one of these leaky channels, and you will have food in your digestive tract that is not ready to be digested yet, and it will go into blood supply or immune system, and your body will have an immune response to it, right? This is also how you create food sensitivities, right? Like severe milk allergies. This is how this happens, okay? Gluten sensitivities, got it? The reason that autistic kids have such gluten sensitivities is because when they're vaccinated, that causes issues with your gut like you can't imagine. And then we end up, it's very common, not always, but very common to have these gap junctions in autistic kids, and now they have sensitivities to everything. And then everybody thinks the solution to autism is gluten-free diets. No, it's not. It's to get them healthy from top to bottom again. But the reason it's important for you is if you have an unhealthy gut and you have things going with your digestive tract and you don't fix it, be prepared. Eventually, right now the United States government says the #1 factor for the decline of the U.S. population is not cancer, it's actually autoimmune diseases. It will be the #1 diagnosis in the world in the next several decades. And it's because it's climbing so fast. Does it make sense? Right? That's why it's so important that you get this figured out. Does it make sense? Everybody with me? Right? We got to close the gap junctions. How do we do that? Everybody here is one of two people. You are a person who needs the daily action steps and a GI reboot, or you're a person who says, listen, I've got some other things going on. Now I know it because I've been here and I kind of recognize it, and I don't need to guess, so I need the metabolics. Okay? Now you might start the metabolics, but if you're going to do that, you would rather them start the GI reboot after they do their metabolic test?
They can do their metabolics test, and while they're doing the like when they're done with the test, they just write on their health assessment with supplements from there.
That's something they're doing. Okay, so you don't have to wait. That's good. I didn't know. So thanks for being here for that too. But there's a 14-day. Why 14? Because that's how long it takes to actually thicken the lining of your digestive tract and start closing the gap and start healing your gut. Okay? So the first step you do is you actually start taking care of the offending bacteria. Make sense? So you start out, that's how this whole thing starts. And then you go through, and through basically these 5 products and then eating the advanced plan for 14 days, you basically heal the gut. Got it? Now let me prove this to you. So pro-L-glutamine is going to help heal the gut lining. It actually helps decrease the inflammation. Okay? For you guys that are flashers or diarrhea people, this is going to be you. Max GI, okay? For you guys that are the overgrowth people, it actually punctures bad bacteria, punctures their cell wall, and actually kills them. Okay, so it actually decreases all the weeds. So you guys that are all messed up from past antibiotic use and all the rest, it does. Pro-Omega intensive formula, it's going to drop all the inflammation in your gut. All of it. It's going to drop it down. And then vitamin D. Vitamin D has a massive effect on your digestive system, and they're probiotics and prebiotics. Some of you guys go, well, listen, I've got vitamin D, I got it from Walmart. or I got it from Vitamin Shop. The difference is you don't have prebiotics in your vitamin D. What's a prebiotic? Like an oligosaccharide. If you're taking probiotics right now, we know now that if you don't have prebiotics in it, you're probably wasting your money. Got it? The other thing that's here is this, Max Greens. Okay, raise your hand if you've tried Max Greens. So most people here, most people take Max Greens because you're not getting enough greens. You're not getting enough nutrition from green sources. But there's a whole nother reason to take Max Greens. Max Greens is loaded with digestive enzymes. So it takes the pressure off your body from digesting. This is what helps. In fact, I'm going to do something tonight. Who liked field trips? Anybody like field trips when you were a kid? I like field trips. I liked examples. Don't give me the book. I want to see it. I like to put my hands on it. I was that Johnny at the back of the class, couldn't wait to get it moving, right? I know it surprised you, but I have in my hand vanilla pudding. This is not the healthy kind either. I got non-healthy for a reason. What I'm going to do is I'm going to open this, okay? I'm going to open this right now. Put it right there. And this is also vanilla pudding. It's exactly the same, okay? So I have two things of vanilla pudding. I'm going to open this, like so. Put that right there. Now, I have in my hand Max Greens, okay? Max Greens, not only does it have all the nutrition that you need from your green source, but in it is packed with what? What did I say? What kind of enzyme? Prebiotics, but digestive enzymes. Now, what you're going to see is, watch this. I'm not going to put a whole lot in there. I'm just going to put a little bit. So just a little bit. I'm going to take this. I'm going to put it in one of these, okay? Now what's going to happen is the digestive enzymes that are in this are literally going to digest the pudding while it sits in the cup. You ready for this? So I'm going to put that right there, like this, and it tastes good too. Now all I'm going to do is I'm going to fold it in there a couple times so that it actually can just get in there. Boy, this is thick stuff right here. Sorry, I'm making a mess a little bit. Sorry about that. You know, your team right here, do you see how thick this is? This is crazy. I can't even get it to fold in there. Hold on. Are you seeing that? Look at that.
Wow. And so what's
That's
the
thick.
What number that is?
Yeah, what number is that? That's the sinker right. That's the swimmer. That's the swimmer right there. Now what you're going to see is I cannot get this to get in there. This is like atomic pudding. I haven't seen unhealthy pudding in a while, so now what I'm going to do is,
After surgery.
yeah, this is what they give you at the hospital to get healthy again, right there.
The pudding.
So what I'm going to do is I'm going to leave this right here, and I'm going to come back to it, okay? And what we're going to find is, as I'm sitting here talking, this is digesting this in the cup. Got it? So I'm going to leave that right there, okay? Now I'll come back to it, okay? Now, so what is the steps? They'll go through it. This is something seasonally that every single one of you need to do. If you've never done it, today's your start. Got it? And again, in spring times when we do most of our stuff, we also do a big gallbladder flush in the fall. This is the time to do it. Got it? Why the spring? We're coming out of the winter, and this is when all the berries and the fruits start coming again. So it's good to get a spring clean on your gut before you start doing a lot of the fruits and stuff again, right? So you're coming out of the fats and protein winter. And this is the products. Very simple. Got it? So we're going to move on from there. Now, what are the daily action steps? And we're almost done. What are the daily action steps? Very simply, okay? First and foremost, number one is what? Healthy nerve supply. Listen, if you're a patient, that means do your stuff at home. Got it? Do not tell me that you believe in chiropractic and the nerve supply and being healthy through adjustments and go home and not do your stuff at home. You cannot tell me that. So do your stuff at home. Next, decrease your intake. Now, why am I saying that? We live in an overeating society, and I am just as guilty as everybody else. But it's just like the whole jeans analogy. If you put 30 pair of jeans in a washing machine, you should not expect them to get clean. And you cannot expect your food to digest effectively if you're eating all this stuff. Who here in the last week, and I'm going to raise my hand first, ate so much that you were uncomfortable? I was a pastor of a church, for the love of Pete. You raise your hand. Am I the only one? God, do not strike us with lightning.
You said this last week.
This last week. Or the week before, okay. Right there. So decrease intake. Next thing, chew your food. I'm always reminded of Dr. Kimberly's brother. He was diagnosed with what was he? Colitis. And actually the doctor was an older doctor, was really kind of knew what he was talking about. And he said, hey, we just need to chew your food. So he made him chew his food like
think it was like 35.
35 chews every bite. And he did, and his colitis was completely gone.
Now think about babies, they take a really long time to eat. We are in such a fast society.
Hurry, rush.
We don't even chew, we swallow our food.
Yeah, so don't just swallow. Chew, 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 chew. You need to have this thing almost liquid in your mouth. Got it?
Chew, 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 chew.
Chew, chew, chew.
3 trains.
3 trains in, 3 trains out. You got it. Eliminate processed foods. Eliminate processed foods. Wonder Bread is not a wonder, okay? You don't have to wonder about it. Get rid of the processed foods, okay? Cereals. I have a lot of parents who are like, the easiest thing is just cereal in the morning. It is not okay, right? Get rid of this processed foods. Increase raw foods, not just because of the fiber, but also because of the nutrition. But here's the thing, if I put broccoli in you, even if you chew it, it's going to what? Go through and it's going to clean your tract. Got it? Fiber is good. Raw is good. The problem is most of you guys don't even get something raw once a week. I mean, honestly, the average person doesn't get anything raw. I mean, last time you had a raw carrot or a raw broccoli, you're like, oh, I can't eat raw broccoli. Eat raw broccoli, for love of Pete, right? Raw. You can, yeah, oh yeah, you can juice a liter of it. Increase hydration, very important to digestion. Now, not at the time, like you don't want to go sit down to eat and drink 46 ounces of water, right? And then dilute all your stomach acids. It's not something you want to do during, but just throughout the day, you want to drink lots of water. If you're dehydrated, it actually affects your gut big time. Also decreases your glandular excretions, including bile. Okay, so to make sure that you're digesting well, you have to be properly hydrated. And last is cleanse. That GI reboot is so important. It's the very least that you can do once a year, especially when we're making it more affordable for you guys, and we'll all do it together. Okay, so GI reboot is a good start. Now, are there other cleanses? Yes, there are. I didn't want to go in too long tonight. There are gallbladder cleanses. There's liver cleanses. There are parasite cleanses. There's kidney cleanses. Things like this. Most people do not have to lose their gallbladder. If you're not somebody that's looking at having to do that, you can actually get rid of. We had one lady that was scheduled for gallbladder surgery. She came in. She passed over 250 gallstones out of her gallbladder and her liver. Filled the toilet up. She took a picture, which most people were like, ooh. I was like, yes, it was awesome. Like full of gallstones, which is the craziest thing, right? It was nuts, right? And it didn't hurt, and it doesn't hurt. It doesn't hurt. It's not like a kidney solid like crystalline stone. And the cleanse prepares it. Now watch this. Who here would like to not have to pass 250 stones anywhere at any time? Now guess what? But wait. You're packing stuff in your mouth and out your rear end constantly, and unless you're eventually clean up, it's like spring cleaning. If you never really cleaned your house, if you just picked up your kitchen, but you never got into the corners, you never got into the back of your closet, you never cleaned anything out, you'd have so much stuff accumulate. Who here has moved houses in the last decade? You're like, I felt so much more light and clean when I got, right? Yes. It's because you moved. Well, guess what? You need to do that internally. That's what this is all about. There's 4-step process Dr. Hulda Clark has. And that's the stuff that we have at the office. Do we have it up here? Oh, it's right here. 1, 2, 3, 4, just like that. Okay? And there's the easy stuff. Before you jump in on that, make sure you talk to her. Because you may, I know some of you guys are like, I need that gallbladder cleanse. Well, maybe the first thing you do is not waste your money on that and do something else first. And I don't want anybody to waste your pennies because they all count. Got it? Make sense? So make sure, and listen, if you're confused about anything, you have a question, you always sit down with us. Does it make sense? Always sit down. So where does this start at? Now, I didn't mention magnesium. Magnesium. Anybody here that's constipated? It's the easiest thing. Okay, magnesium. Raise your hand if you've taken magnesium from the office before. My favorite one, if you're taking notes, is raspberry lemon. But there's raspberry lemon, cherry, original unflavored, and then orange. Okay, this is the bomb.com right here. Got it? You put it. It's just powder. You put it in water, and it fizzes up. Right? And I take this every single day. My wife treats me like a king, and I get done with my workout, and she makes this with vitamin C, and she gives it to me before I get in the shower. Thanks, babe. You're awesome. So every single day. Got it? But it helps with that. Other thing it helps with is like, anybody get the creepy crawlies in your legs at night, almost like a restless leg kind of thing? Magnesium is awesome for that too. Charlie horses and cramps as well. But GI reboot program. This is one, I think everybody here, she and I are going to be starting it with you guys. And so just make sure that you get that tonight before you go. Stop guessing, get tested. Metabolics. How do I do metabolics? What is metabolics? You take home a test kit. You don't have to go to a lab and get your blood drawn. Here's the test kits right here. There's one, there's two of these just like this. One is pee, and then you put your pee in there, and then you freeze it, and you send it off. And then one is just a finger prick with blood, and you put it on a little card, 5 little things of blood. And if you can't do it, you're not comfortable, we'll do it for you, no big deal. And then you send it off. It takes 2 weeks to come back. Then you sit down and go through with Dr. Kimberly, and she goes through exactly what your needs are and how much of those that you need. Make sense? I'm going to pray it up, and I'm going to take some questions. If you know what products you need, everybody here I should believe is going to get the reboot. But as soon as we're done, you're good to go. But I want to take some questions. So if you would, bow your heads. So Father, we just love you and praise you and thank you for the opportunity that we come together. I just thank you for this room. I thank you for a bunch of heroes that are infectious with excitement and health for people who don't have either of those. And I ask that this room becomes an encouragement, Father, from you through them to people who are actually really, really praying for help today. I ask, God, that it goes from this room, it goes to that camera over there, it goes to every single person on the World Wide Web, that thousands and tens of thousands of people watch this, they get encouraged, they find the answers to the solutions to their problems. And I ask, God, that your name is glorified because we were here today. So, Father, we just ask all these things that as we take steps towards you, that is always in what we say, that you take great God-sized steps towards us. So we love you, Father, and we pray all these things in Jesus' name. Amen. Amen. All right, so you guys are free. They're ready to take product orders up front and some questions. Oh, pudding. Yeah. So it was frozen. That's what it was. It was frozen. But if you look, watch this. So even though it's digesting it, if you want, it was digesting at the bottom really good. So it's liquid at the bottom. But what you'll see is it will pour. If it wasn't frozen, that's why it acted weird. It will literally pour like liquid, and some of this will. But at home, try that one.
It's really messy.
But this, I mean, it's frozen solid. So that's why it didn't work out. Actually, I did it on one of my makeovers. If you saw it, it turns into just water, and you just pour it out because it digests in the cup. It was my fault because it got really hot at lunch in my car. And so I put it in the freezer, so sorry about that. So, but with that said, anyway, listen, questions about your digestion, questions about a condition, have we seen results with? Yeah.
Magnesium.
Yeah.
It is very essential, and I know many people are low in it.
Number one missing ingredient as far as mineral.
That's what I understand, but it causes diarrhea, and you have a tendency to go there.
Yeah.
And then it's too much.
Here's the thing, a lot of people will have a tendency to have diarrhea even at smaller amounts with magnesium. And that, for that reason, oftentimes is the gut has issues to begin with. And so that's where we end up saying, okay, so there may be a problem on top of that, because you should be able to take some magnesium and not have a flash. Yeah.
But usually you know how much magnesium you need if you, let's just say you take a teaspoon. If you take a teaspoon and your stools get really loose, then drop down to half a teaspoon. Some people can take 4 teaspoons, and it's Dorota shaking her head.
I can't.
Can take 4 teaspoons, and it's like, oh, okay, that's the happy balance. The beautiful thing about magnesium is you find out how your body responds in one day, so you can adjust it the next day. So if especially if you get cramps, like you want that result, right, quickly. So, yeah.
We're working out 6 days a week, and we work out so much that
7
we deplete it. Okay, 7 for her. Anyway, but we work out so much that oftentimes if we don't take magnesium, we'll feel like you got little worms in your calves. They'll just go like this at night, and it totally gets rid of that.
It's the number one reason what people show up at Parkland and they have angina or heart conditions.
It's actually magnesium.
Heart problems. It's really magnesium issue.
So angina,
So
yeah.
the fat part too, that just means not the healthy fats. When you sip the fat, the color of it, you're not talking about nuts and avocados and.
Yeah, well, any healthy fat, if you're not digesting it, will come out. If you're not digesting that, even healthy stuff, which is
You're
really
just asking
important.
about fats.
So when it comes out, if it's a tan or it's yellow or right, then you're just not. If it's a floater, if you have a lot of floaters, then you're not getting fat in, and that is if you're not getting a lot of fat, you will have hormone problems. You have problems with weight. You'll have problems with energy. You have problems with depression sometimes.
The good fats.
The good it doesn't matter. Yeah. So like a lot of times you guys will spend money on healthy foods, lots of good foods, and you're not digesting it, which is why this talk is so important.
Yeah.
Got it.
Good, yeah.
Yes.
Okay, can children take the Calm every day?
Can children take the Calm every day? Dorota wants me to repeat. She's over here going, people in the back can't hear, and the
Yeah, our
camera
kids
won't
take it.
know what you asked. So can children do it? My kids take magnesium every day.
And it tastes great.
Now, my daughter, when she's in track season and she's putting a lot of miles in, she needs more magnesium. So I'll send her with a water bottle
the
with
track meet.
magnesium to the track meet. And then she doesn't get Charlie horses and cramps in her feet when she's running. Yeah.
Let's go here and then there.
So magnesium, you don't have to drink it right away. You can.
Yeah, put it in a bottle.
Okay.
Yep.
Yep.
Yeah.
Yeah. You can drink it. The magnesium you don't have to drink right away. You can drink it at night before bed. You can mix it and take it with you.
Take it with you to work?
Yeah, you can take it with
When
you
you
to
see
work.
my
It's
thing
fine.
on the windowsill in there, my water, oftentimes there's magnesium
Yeah.
in there. I just have it all day. Yeah.
I think
Here,
Dorota
and
walks
then over here,
around with
Gina.
magnesium water as well too.
Back of the container says, if you're pregnant, contact your
Yeah.
doctor.
The back of the container says if you're pregnant, contact your daughter on taking it.
You contact
Yes, that's
us.
true, but
You
yeah.
contact us.
Yeah,
We're
still okay.
contacting.
We're contacting.
So it's still okay, 'cause she was asking.
Yes.
Yeah.
What is the difference between, because I take the Metabolics magnesium.
Yeah, it's great.
the
It's just
other.
preference.
Can I take both?
It's just preference. You can take either one, whichever
Yeah.
one. I have some patients that will only take. She's asking about the difference between the two. There's the Metabolics magnesium. It's just preference. Some people really prefer. I need to come closer to you because of the microphone. But some people really prefer this one, and they only want to take this one. And some people really like this one. It's really just preference. Some people really would just rather teaspoon it. This one's a drink. So it's just.
If you're already taking this one,
They
be
both
careful
work
because you'll
fantastic.
get to bowel tolerance
Yeah,
pretty
you don't
fast.
want to. You don't want to take both. Just choose the one.
I've never had the effect of,
Diarrhea?
yeah.
Yeah, then you're good because you're
Fine,
taking
yeah.
what you should be taking.
Exactly.
That's fine.
Good.
Yeah.
Other questions? Yeah, go ahead. Yeah.
On the regularity, so how do you go from going once a day to like 3 times?
GI reboot.
That's the reboot?
Yeah.
GI reboot.
It's all part of the whole cleanse factor. Says if you cleanse out all the sludge that's in there,
Hey guys,
then you get everything.
listen to
moving
this.
again.
Okay.
I guarantee if you do that GI reboot, you'll be bragging about your poop. That's not a joke.
You can brag to us. We love talking
Yeah,
about poop.
you actually text me. You can even text me a picture. I know you want
My
to,
nanny
Lauren.
was so funny. She was like, "Are you talking about poop tonight? I love that you're talking about poop." Like she's so happy. We're parents. We don't.
Yeah, exactly. We're talking about all the
Anybody else? Yeah.
Sometimes when I travel about a whole week, maybe I can't even do it.
Yes.
Okay.
Get constipated
when you travel, you get constipated. That's usually because you're mineral and dehydrated. We never travel without a baggie. It looks like, it's funny, it's like a baggie
Can
of
you
powder.
imagine a baggie of white powder?
And we
It looks
travel
bad.
with our magnesium. We
like
find
Coke.
that we need more of it
Terrible.
when we travel. Like if we normally would get like a teaspoon, we probably find we need a teaspoon and a half to 2 teaspoons when we travel.
Here's the other thing
So
too.
yeah, that's good.
When you
point.
travel, oftentimes we get off on when, like you eat the same time every day, right? So your rhythm of
Yeah.
when you eat is off when you travel, especially with like overseas time zones.
You don't eat home cooked
And
food
that
either.
will throw you off too.
Yeah.
That'll throw you off too, yeah.
It's okay to use bind and then next.
Yeah, if you're taking the body detox or bind, you can take magnesium with it because it does have magnesium in it. So yeah, you're good.
Now if you take a lot of this and you take a bunch of bind will bind this too. It will to some degree. It will
Well, I
bind
mean,
this.
yeah, it depends on if you take a bunch.
Yeah. So like if you
Yeah.
like we talked about.
You're
Yes.
good. You can take them at the same time if timing is what you're looking for.
Yeah.
Yeah.
Yeah,
that's
I
fine.
didn't know that. Yeah. Yeah.
Where do we get the bind? Is it
Bind is up front, and
Yeah.
the way that you travel, Lawrence, you need to have that in your bag every time
Yeah,
you
I
go.
always, when you travel, like I always take the detox system with me when I travel, but sometimes you might need some extra charcoal, and that's what bind is. It's BIND, and it's in the cabinet off
here.
to the right, under the TVs.
Up front. I
In
have
the
it up
front
front.
office, yeah. That's
If you guys
something
have
always
kids,
kinda
ever
have
have kids at
around.
your kids or grandkids at your house, you have to have that bind there.
Like a food poisoning or a
Someone
traveling
gets into a bunch of
issue.
toothpaste, or someone got into grandma's penicillin cabinet or something. Gotta have
Charcoal
that there, charcoal all the
grabs
time.
it.
You will never have to go to
Yeah.
the emergency room. Yeah.
If you have, not food poisoning, but it's just loose stools,
Yep.
and you take Vine, what's
Bye, guys.
better or worse? What's indicated? More fiber, like psyllium,
Usually,
or Vine?
usually more fiber. Now,
would
that's
start
a
it-
complicated question
Yeah.
because it depends upon
It depends on what's causing
history.
it, how long it's been going on, how bad it is, how often you're having that in a daytime, right, or in a day. Like if it's 6-8 times in a day,
If it's a food poisoning issue, that's a different question. So, for example, my daughter gets food poisoning and she can't get off the toilet, and this has kind of gotten, or even throwing up, and it's like we're past that point, like we've certainly got everything out. Then I do bind, and I just keep giving it to her even if she's throwing it up and it's coming out black.
occasionally
I just
you
keep on
get-
giving it to her because eventually you get enough down and you'll stop.
yeah, occasionally though you'll get a hold of something that you got exposed to and you'll have digestive irritation. That's just, we live in a crazy world. And watch this, when that happens, yes, increase your fiber. I would say maybe increase your detox system or make sure you're taking a detox system. And then if things are still going on, if you haven't done like a GI reboot in 6 months to a year, that's a good time to do it, right? I mean, if you got a healthy digestive tract, what it means is it should heal itself and go back within a day, 2 at the tops. If you're having something that's just every time I turn around I've got some loose stool, that's GI reboot. You start there. And then if you do a GI reboot and that's just not covering it, 9 out of 10 people, something like that, it's most people are good with that.
Yeah.
If that's not, that's when you say, listen, all bets are off, now we do metabolics.
Yeah,
now we
that's
figure it out.
that's the complicated stuff that's like doesn't seem to quite clear up. That's the stuff that you really want to make sure that you get tested for. Yeah. Yeah. Was this good for you guys?
Was it good?
Yeah. So we shared our
Good to see you.
anniversary and talked about poop. Isn't that awesome? Thank you.
Poop, baby. We talked about poop. It was awesome. Yes. Poop. Mwah. All right.
All right, guys. Well,
Good.
I'm here if you have any questions, okay?